Salutations, everyone, and thank you for downloading the 12th episode of DiabeticRadio.com. In this episode, I would like to discuss a little bit about health insurance. You know, you get a job. For most of us, especially older folks, you know, about the second thing that we worry about is health insurance. You know, when you work for a good company, you bust your butt, you work hard, you would expect that you would have at least basic health insurance so that in the event that you or your family member gets sick, you're able to take care of yourself and your family. But the fact of the matter is, there are many different health insurance packages, and depending on who's the provider of that health insurance, you get what your employer is able to afford or is willing to pay for, and sometimes the options are small. Now, for people who are relatively healthy, they usually don't have to worry much. But if you have a chronic disease like diabetes, I think it's very important that you take the time to look through all of your health insurance material, because I realize that most people, you know, they don't know what their insurance offers. They just assume that, you know, once you get that health insurance card, it's like everything is covered. And this isn't true, especially with so many changes that has occurred since this new health care bill. You owe it to yourself and your family to find out exactly what is covered and what is not. And if you're not sure, I think it's a good idea for you to have some questions written down and call your insurance claims office to find out some of the basic things that should be covered and make sure that they're covered, such as yearly examinations or any preventative procedures, you know, diabetes supplies, is dental covered, is eye care covered, those basic things that, you know, almost nobody really bothers to ask. And as diabetics, we need to be on point with that. Or if you have a child that has diabetes, you really have to be on point with this. And, you know, once you get that insurance card, it's kind of like a credit card. You know, people just present the card, and, you know, every time you go to the doctor, and no one ever thinks about what's covered, what's, you know, what's your available balance. You know, we need to find out these things. And a lot of the times, you know, a doctor will tell you, you need to have this, you know, a particular procedure done, and you find out at the last minute that that procedure is not covered, and the next thing you know, next month you're stuck with a $3,000 medical bill because you found out, you know, afterwards that the procedure was not covered for whatever reason. I think that it's a good idea that before you have a procedure done, ask your doctor or, you know, whoever takes care of the medical billing at your doctor's office, find out what is the likelihood of that procedure being covered. And if they don't know, and if they're honest enough to tell you that they don't know, ask the office to give you the billing codes for that medical procedure, and you call your insurance and give them that billing code and see if that's something that normally would be covered, so that this way you don't get sidetracked and get hit with a $3,000 or $4,000 health care bill for a procedure that you may or may not need. I mean, if it's not life-threatening and it's something that you don't need right away, I don't see a problem of you just doing your homework and checking it out first. It's bad enough that diabetes costs so much. You don't want to have any more unnecessary medical bills added to your list of already existing problems. I hope this helps, and I give all my viewers some positive energy, and I pray that God gives you the strength and answers that you need to help cope with your diabetes. Thanks for watching. Bye-bye.